Welcome to another episode of the Science Guide ASAP Learning, where we simplify complex medical topics. Today, we're diving into the world of major depressive disorder. Hope this helps. Please support this new channel by liking this video and subscribing for more videos like this one. Hello, students. Today we will be discussing one of the most common mental health conditions worldwide, major depressive disorder, often simply referred to as depression. Depression is characterized by a persistent feeling of sadness or a lack of interest in outside stimuli. This is not a transient emotional state, but a persistent one that affects a person's life significantly. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, for a diagnosis of depression, 5 or more of the following symptoms have to have been present during the same 2-week period, represent a change from previous functioning, and at least one of the symptoms should be either depressed mood or loss of interest or pleasure. Depressed mood most of the day, nearly every day. Markedly diminished interest or pleasure in all, or almost all, activities most of the day, nearly every day. Significant weight loss when not dieting or weight gain, or decrease or increase in appetite nearly every day. Insomnia or hypersomnia nearly every day. Psychomotor agitation or retardation nearly every day. Fatigue or loss of energy nearly every day. Feelings of worthlessness or excessive or inappropriate guilt nearly every day. Diminished ability to think or concentrate, or indecisiveness, nearly every day. Recurrent thoughts of death, recurrent suicidal ideation without a specific plan, or a suicide attempt or a specific plan for committing suicide. These symptoms also need to cause significant distress or impairment in social, occupational, or other important areas of functioning, not be attributable to the physiological effects of a substance or another medical condition, and there can't be a history of a manic or hypomanic episode. Depression also has several subtypes, including major depressive disorder with seasonal pattern, previously known as seasonal affective disorder, and postpartum depression, which occurs after childbirth. Let's talk about diagnosis. When diagnosing depression, it's important to rule out other medical conditions that might cause similar symptoms, like hypothyroidism or vitamin D deficiency. A full history and physical, along with indicated diagnostic tests, will help rule out these conditions. When it comes to treatment, the first-line treatments for depression are psychotherapy and pharmacotherapy. Cognitive behavioral therapy, or CBT, is one of the most effective forms of psychotherapy for depression. It focuses on addressing cognitive distortions and behavioral responses to depression. In terms of medication, selective serotonin reuptake inhibitors, and serotonin and norepinephrine reuptake inhibitors, are commonly used first-line treatments. Other options include atypical antidepressants, tricyclic antidepressants, and monoamine oxidase inhibitors, although these are typically reserved for treatment-resistant cases due to their side effect profiles. In severe, treatment-resistant cases, electroconvulsive therapy may be considered. More recently, other modalities like transcranial magnetic stimulation and ketamine infusions have shown promise. It's important to remember that treatment should always be individualized to the patient, taking into account their specific symptoms, severity of depression, presence of any other mental or physical health conditions, and their personal preferences. To wrap up, depression is a complex and common disorder that has significant effects on a person's life and well-being. It's important to recognize the signs and symptoms of depression and know the first steps in diagnosis and treatment. Early recognition and intervention can greatly improve the prognosis for our patients. Hope this helps. Please support this new channel by liking this video and subscribing for more videos like this one.